Hello, I'm Dr. Deepthi Venkatesh, fertility specialist at GarbhaGudi IVF Center. So today we're going to be talking about the role of hysteroscopy in IVF. What is hysteroscopy? Like the name suggests, it means looking into the uterus with a scope. This scope has a camera and a light attached to it and helps us look into the interior of the uterus. So we get information about the cavity, the lining, the glands, the endometrial glands, and any abnormality that might be present, like a fibroid, a polyp, any Mullerian anomalies like a septum, or any adhesions. So the advantage of this procedure is that it is both diagnostic and therapeutic at the same sitting, meaning we can see and treat. So another question that we get asked frequently is if all female partners who are having fertility issues need to undergo hysteroscopy. The answer is a no. So usually when couples come to us with fertility issues, we subject the female partners to a transvaginal scan wherein we see the uterus and the ovaries. Suppose on this scan we find any abnormality like I already mentioned, like a fibroid or a polyp or a septum or any evidence of adhesions, then we confirm it with a 3D scan or an MRI, and then we post them for this procedure called a hysteroscopy, wherein we can confirm the diagnosis, and also if we find a polyp, a polypectomy can be done. If we find a fibroid, resection can be done, and any septal resection also can be done. Another indication of hysteroscopy is when we come across couples who've had repeated implantation failures, meaning they've had embryos transferred to their uterus before, but for some reason they've failed to conceive with those embryos. In these cases, a hysteroscopy will give us additional information and help us decide the further course of management. Also, when some females undergo hysterolaparoscopy, as in they're undergoing a laparoscopy for some reason to see the patency of the tubes or for drilling of the ovaries, then we combine it with a hysteroscopy and also have a look at the uterine cavity. In other cases, it helps us diagnose the presence of endometritis, which is an infection of the uterus. Post the treatment of such conditions, the reproductive outcome of these women greatly increases. Also, when we come across females with persistently thin endometrium, despite all medications that we may be giving them, this procedure is suggested. It may also be combined with something called a subendometrial PRP injection, which has shown promise in increasing both the vascularity and the endometrial thickness. So these are some of the indications where we do hysteroscopy. Okay, now coming to the procedure, it is a daycare procedure done under short anesthesia, which means that you can get admitted on the day of the procedure and get discharged a few hours after the procedure. It usually lasts about 15 to 30 minutes and might get prolonged by a few extra minutes in case there is an operative element involved. So for more such information, kindly reach out to a fertility specialist at any of your GarbhaGudi IVF centers and follow our channel for more such videos.